Okay, good morning. We have a quorum, so we could get started for the EMCC meeting for January 14th, 2026. And we can get started with introductions in the room.
Good morning. We'll do a roll call with members. Will Hiller.
Here,
David Sargenti. Here. Jason Solons.
here.
Thank you. Kurt Shake, who I would like to introduce as new citizen rep. And if it's okay to would it be okay to take a moment and let him introduce himself and anything you'd like to share?
Well, thank you all.
Push the button.
Delighted to be a member now that I know how to work the button. So Kurt Shockey, I am the CEO of the Veterans Transition Center up in Marina. Retired Air Force colonel. I ran the Air Force Survival Program for a period of time where we did a lot of emergency medical training. I have a PhD, but nothing related to medical. So if you need any information on nuclear weapons, let me know. And I'm delighted to be here. So thank you.
Happy to have you. Thank you. Let's see, Paul Wood. Here. Dr. Lutz.
Here.
I know Carla's hopefully online. And Joe Cafaro is alternate.
Here.
Chris Borkin.
Here.
Very good. It is my understanding that John Anthony retired at the end of 2025, so he won't be on the committee. We'll be looking to get him replaced. Ex officio members, Kelsey Scanlon.
Present.
Thank you. Teresa, Deborah Hopgood.
Present.
Leanne Magaski. We'll go with Leslie Oliver.
Present.
Very good. Thank you. With that, we will go to, if I missed any not alternate members. Mike Esslinger is here. Mike DeLeo, thank you very much. All right. If you would like to, you can introduce yourself. If you intend to speak on one of the items, you will need to introduce yourself. Otherwise, we'll go around the room and everybody else can introduce themselves. Thank you, Rachel.
Shane Van Reen, Salinas Fire.
Thanks, Shane.
Stephen Chrissy, Salinas Fire.
Justin Lindquist, Monterey County Regional Fire District.
Ben Hitchcock, AMR.
And I think we've got everyone. EMS agency staff.
Karina Moreno, EMS.
Kimberly Hernandez, EMS Agency.
Devin Delaney, EMS Agency.
John Burley, EMS Agency.
Online, please, if you would like to introduce yourself.
Good morning,
Silas Fish-
everyone. Carla Spencer. Sorry I couldn't be there in person today.
Jalen Neal, EMS Agency.
Silas Fisher, Monterey Fire.
Michelle Kolinsky, Tom.
Good morning, Jeff Horner with CalStar.
I think that's it. Matt. Doesn't have to, doesn't want to. Okay. Thank you very much, everybody.
All right, item 2, public comment. Any member of the public may address the committee for a period not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications but may not take any action. Any public comments?
Will, if I could, we wanted to acknowledge an esteemed guest who is here today in a new role as a retired member of the community. So we wanted to take a few moments to recognize the contributions of Teresa Rios to the EMS agency. Teresa has been a longtime employee of the County of Monterey. She's been with the county for over 18 years. most recently with the EMS agency. She spent her entire time with the county working for the health department, first in environmental health and then with us. She most recently served as the EMS agency director and led the EMS agency and the EMS system as a whole through quite a few changes and improvements to the system. I think a couple things that I'd like to call out as key accomplishments is the long and very difficult process of getting an RFP successfully through the input from the community, the stakeholders, the EMS authority of the state, and meeting all of those technical requirements from contracts and purchasing, our county council, and the various entities who have input into those processes. And I think one of the key things that she included in that RFP is the wisdom and the foresight to allow for the EMS system to grow. So we've all seen changes to the EMS system. We know that there are changes down the road that we may not have even anticipated yet, but the RFP that she put together leaves space for the EMS system to grow into those changes, adopt them, and continue to evolve as time continues to go on and things progress. So we do have a plaque that we would like to present to Teresa, as well as an EMS agency challenge coin. If I could read that plaque, that would be great. Up front. So the plaque says, with great appreciation, the County of Monterey EMS Agency recognizes Teresa Rios for your many years of dedicated service to the County of Monterey and the EMS Agency. Your leadership, vision, and guidance have moved the EMS system forward and improved emergency medical care throughout Monterey County. Your legacy will continue through the EMS system and the individuals you mentored. And then it's dated as of today's date. So I'd like to give that. Love you also. With your name, the title.
Thank you.
Absolutely. Yeah. Would you like to, or would anybody else like to say anything?
Thank you. I wanted the opportunity to see everybody one more time and to say thank you. EMS is a very rewarding field, but it's also a very challenging one. Bringing together people from so many different groups can also add to the challenge, but regardless of those challenges, we came together, the groups came together to ensure that we improve the system for the betterment of the residents. I'm very grateful to have had the opportunity to lead the agency. I grew a lot since I joined EMS, and the success that we have had, it is because of the people who do the work, the people out in the field, primarily, who are usually not receiving plaques like I just received right now, and the people in the office who do all the work. I'm going to miss everybody. I'm going to miss the challenges. You know, I like to work, so getting up every day to come to the office is definitely different. I want to congratulate Deborah on being named interim director. I know that the agency is in very good hands. I know the team is a very good team, very strong team. And Dr. Burley, I thank you. I feel that the EMS agency is very fortunate to have you. The system is very fortunate to have you. I leave feeling very proud of the work that we've done together and the changes that we have brought to the system. And I know that the system is going to continue to grow and it's going to continue to get better. Thank you for allowing me the opportunity to say hello and goodbye. And yeah, thank you.
Before you go. So I just want to say a few words as well, Teresa, I wanted to let you know how much we appreciate the time that you spent here, leading our team, being part of our team, working closely with us, having having fun along the way as well. And you know, I think one thing that I wanted to convey to the group is there's so much that you do and did behind the scenes that most people don't get a chance to see. When Teresa says she likes to get up in the morning and come to work, she oftentimes would be at work at 5, 6 in the morning, way before any of us were there. I'd come in the morning and she'd have been there for hours, or she'd have come in the evening and stayed late at night or working from home. And so I feel like she always kind of had the EMS agency and the system at the forefront of her mind, even on days when she was, you know, not working supposedly. That kind of dedication really reflects the sort of oversight that you provided as director of the EMS agency. We were very fortunate to have you, and I really appreciate the time I had working with you and the relationship we had moving through those years. And so I have a lot of gratitude for that time. So thank you for all of your very hard work. Thank you for all your attention to detail. You are probably one of the most detail-oriented people that I know, and you know, the RFP, I think, reflects that. And you know, that is not a process that you can just sort of wing. That's something that you have to be very focused on every single area, and also have the capacity to push forward when it becomes difficult. And I think that's another sort of key component of Teresa's personality, is that this was not an easy job. This is not an easy task. And there are many times when it's difficult. And she had the ability to continue to move forward and to say, okay, how do we address this? What's next? What's after that? How do we move forward? And that was always her approach, regardless of what challenges we faced as an agency and as a system. So sort of acknowledging all of that, thank you, Teresa, for the time that you've been here. Thank you for leading us through this, through the last many years. And we really appreciate everything that you brought to the team and to the system.
Thank you very much.
Thank you, Teresa.
Thank you.
Okay, moving on to item 3, approval of past EMCC meeting minutes. We get a motion to approve the November 12th, 2025 meeting minutes. All right,
Who's for second?
motion from Chief Sargenti and second from Jody Schaefer. All right, moving to,
Need to do
a roll call, sorry. And to do a
show of hands.
show of hands. All right,
All right.
those in favor? Those opposed? All right, carries.
Excellent.
Awesome. And then moving on to standing reports. Deborah.
Yeah, good morning, everybody. I want to start off with an update on staffing. We talked about that a little bit at the last meeting. At that point, we had postings out for 2 EMS analyst positions. At this point, we have extended conditional offers to 2 candidates. They are going through the background check process, so that typically takes some time to get live scan results, that sort of thing back. So we'll keep working with HR to go through that and hopefully have 2 new folks on board during the first quarter of the year. That's the goal. We're also continuing to explore alternatives for our health program coordinator position. So we talked previously about the potential to transition that to a more EMS agency focused QI coordinator type position. We're still looking at that. With the departure of Teresa, it leaves us down 1 additional position from where we were before. So we're also looking at the possibility of doing a short-term underfill, is what the county dubs it, of that position, to bring in an additional EMS analyst candidate, which we think will be a little easier to recruit for potentially. So hopefully some reinforcements are on the way. Second, I wanted to mention Certami. We've talked about this at CQI Tag and then CCC. It's a new online software system that will allow for electronic processing of applications for EMT certification and paramedic accreditation. EMS agency staff has been working over the past few months to implement the software. We think it'll bring a lot of improvements to the application process as far as allowing people to complete their applications online. They'll be able to store their documents online, so things like CE certificates, driver's licenses, if they want to, CPR cards, that sort of thing. And then it will also send out automated email alerts as people are approaching their expiration date, and then as they are finishing and our staff is reviewing components of their application. So I think it'll improve communication quite a bit. Our current plan is to go live with this on February 2nd. We have a plan laid out to continue to publicize the software, including releasing some training materials, a training video, FAQ document, that sort of thing. And we'll also be doing some limited end user testing with people who are set to expire around the startup date. So that's a big project that it will be nice to get in place, and I think a good addition to the system. Last week, we started working on the initial first steps with Health Department IT to update our website. As any of you have visited, have probably realized it's a little clunky. There's a lot of information on it, but it can be difficult to navigate. So we're looking to really streamline things, get things better organized, and make it a more user-friendly experience and easier for people to find things. So that's going to take some time to get done, and we're a little bit tied to Health IT's web or their schedule. So we're hoping by end of 2026, early 2027 to be at a good place and have a working new website as well. We have also recently started work on the 2025 EMS annual plan. So this is a requirement that is put in place by the state EMS authority. It's labeled the plan, but it's really a little bit of a misnomer in that it more summarizes data from 2025. So we're working on getting all of that data together, making the updates to the executive statement, that sort of thing. That will go to the board in March and is due to EMSA March 19th, and we'll make sure that this group gets a copy as we get to a more finalized version of that, probably for the March meeting. We will also soon be starting work on our 2025 annual report to the Board of Supervisors. Just as a reminder, we usually take that to the board in May during EMS week with the EMS week proclamation, and then a brief presentation to the board as well. And we have the ambulance services provider agreement under its own separate item, so I'm going to hold off at this point on any updates to that and discuss that later. So happy to answer any questions if anybody has any.
Thank you, Deborah. Item B, EMS Medical Director, Dr. Burley.
Thank you, Will. Just a few items from our CCC meeting, which we just completed earlier this morning. We heard from Deborah regarding some EMS agency updates, which you've just heard. And we also received a report from Kimberly regarding the APOT patient offload times. Seems that there has been some misunderstanding between the state and many of the LEMSs throughout the state in terms of the time utilized as the time of turnover from the EMS unit to the hospital. I think many of us were under the impression that the signature time was the time of turnover, and as it turns out, that's not what's being utilized by the state as the turnover time. The turnover time is the time that's documented by the EMS provider as the time of turnover, and the signature is utilized to verify that time is correct. So that helps to explain why the data that we had was not syncing well with this, with what the state was getting. And so now with that better understanding in mind, we have moved forward and found that our data from last month actually does correspond with what the state is getting, which helps, I think, all of us at least understand how the rules are being applied. So that was helpful information. We also heard about the health data exchange implementation progress, which continues to be going well. and we're in the 90 some percentile in terms of utilization. We heard from Steve regarding the 2026 policy and protocol review cycle. He reviewed public comments and the EMS agency's response to those comments, and we had a chance for further discussion there. We had an update on the 911 nurse navigation program, its implementation, some of the progress from the working groups, and the philosophy of our local EMS agency in utilizing the program, which is designed to help to identify patients who are very low acuity, patients who probably don't require the emergency department and probably don't require an ambulance transport to the emergency department, that may be better served with other resources in the community. Helps to take a little bit of the burden off the EMS system as well as the emergency departments, and allows them to focus on patients who are higher acuity and more appropriate for emergency services. The 2027 policy and protocol review cycle is coming up, and so Steve reminded us that anyone with any requests or recommendations or things that they'd like to see addressed for the upcoming policy and protocol review cycle are encouraged to contact us via email to let us know that there's an item that they'd like us to review. And we also lastly got an update on CQI tag. So those were the highlights from the CCC meeting. Happy to answer any questions that you may have.
Thank you, Dr. Burley. Item C, MOAC, Deborah.
Yeah, so just a couple highlights from the time since our last EMCC meeting. In December, we went out to Carmel Valley Manor and we participated in a panel presentation on wildfire response. We reviewed some of the information about the EMS system as a whole and how it functions, and then what the response to a disaster like a wildfire at that facility might look like as well, as far as the ability primarily to bring in transportation resources, whether they be ambulances, mutual aid ambulances, strike team ambulances, alternative means of transportation to help with the evacuation of residents in the event of a wildfire. So that was a good experience. It was great to hear from the other members of the panel who presented on the same topic, and just kind of get a bigger picture of what the response to that would look like. So we also, in December, participated in a healthcare coalition tabletop exercise. It was focused on the idea of long-term care facility evacuations, timely enough. Had several good conversations with the local facilities about available resources. I think those conversations are always important to sort of give people a realistic idea of what's available in the system and how long it will take to get those ambulances and what a response might look like. So lots of good conversations from that. Finally, we've been working with the Healthcare Coalition, a couple of EMS provider agencies and the hospitals on the medical response surge exercise development and planning. There will be a tabletop exercise that's scheduled to take place in February with all of those agencies participating, and then a full-scale exercise that will take place in April. So we'll keep you posted on developments related to those as they come up. And if anybody is interested in participating in that medical response exercise, just please reach out and we'll tie you in with the Healthcare Coalition and get you set up to do so. So that is all the information I have. Happy to answer any questions if there are any.
Thank you very much, Deborah. Okay, moving to EMS system performance metrics. Item A, communication system testing. Kimberly.
This is still on. Good morning. Okay, so we're going to go over the ReadyNet and 800 megahertz. Those are included in your agenda packets. We're going over October and November, kind of status quo. There were some dips in different November for, there was a dip at Natividad for ReadyNet, but November for 800 megahertz, everyone did pretty awesome. in responsiveness. October, minor dips, but I do connect with the hospitals every month after the drills are completed. So keep in mind, we did get notified during December that Natividad was having trouble with their handset. They reached out to the radio shop. The radio shop let them know that the 800 megahertz phones that are currently at all of the hospitals, they're kind of old and they no longer make parts for them anymore. They have some parts around the radio shop that they can use to kind of fix them as best as possible, but they're kind of at the end of their life. And so we have worked with the radio shop and also LinkedIn hospital preparedness on what it would be to replace those. So we're working with the radio shop. They're going to get together kind of like a quote, like a generic quote on what it would be to replace the 800 megahertz. Doesn't mean if you have one that's functioning, you need to. It's just that if it goes down, they might not be able to repair it. So just keep that in mind for the hospitals. And of course, and there's one at AMR Dispatch. So that's in the works. We'll be connecting with the hospitals on that and anyone that has an 800 megahertz radio. Any questions on 800 megahertz and ReadyNet? Okay, I'll jump into contract compliance, if that's okay, Will? Okay, so contract compliance, there was a PowerPoint included in your agenda packet as well. I'm just gonna quickly kind of go over any reportable priorities for, again, we're going over October and November. Any reportable priorities met or exceeded the 90th percentile compliance for those months. So that's great. And that is all I have on that. Any questions on contract compliance for October or November? Okay, thank you.
Thank you, Kim. All right, moving to old business, EMS ordinance revision. Deborah.
That's all.
Oh, that's on hold. Sorry, it's right there. Health data exchange, Deborah.
Yeah, so Dr. Burley mentioned that the numbers are continuing to be positive for the health data exchange match rates. This is an item that Teresa had been working on until the end of December when she retired. So I will be evaluating this and we'll be looking at what the next steps are that are needed and more information to come in the future on this.
Thank you, Deborah. Item D, PCR data standardization.
Basically the same update at this point. It was an item that Teresa was working on and we'll be evaluating to see what we need to do next with it.
Moving to E, EOA ambulance contract transition, Deborah.
Guess I should have just kept the microphone on. So we are continuing to meet on a weekly basis with AMR to go over status and updates on implementation during the transition period between the two agreements and moving into the operational period. As a reminder, the new agreement, the operational period goes into effect as of February 1st. So that is when all of the new requirements and systems and priorities and that sort of thing will actually formally go into place. Since the last EMCC meeting, at that meeting, we talked about the meeting that we had held with AMR and the fire agencies to review the features of the new agreement, to answer any questions, that sort of thing. In early December, we held a similar meeting with all of the hospitals, went over the components of the agreement that are more kind of pertinent to the hospitals, answered their questions, heard their concerns, and had a couple follow-up items out of that we've been working on. So as far as the status of the transition period, a good number of the requirements have actually been completed at this time. We're using a project management tool to track that, and I'm happy to say that we have a large number that we've been able to move to the done pile of things. We do have a small number of items that are still pending or documents that the EMS agency is in the process of reviewing for final approvals. Some of the larger pending items, just to call out, are the agreement with ECD for dispatch space. We hope to have a signed draft from AMR back today to be able to get that to the Board of Supervisors in time for the last meeting in January prior to the go live date. So if not, we'll be needing to look at a retroactive date for that. So more to come as we keep an eye on that. We're also working with AMR to develop a customer satisfaction survey that will go out to patients who are users of the service and have been treated by AMR to gauge their level of satisfaction with the services provided. And then finally, and AMR is working on potential additions to the CCT program. So we are continuing to work with the State Emergency Medical Directors Scope of Practice Committee to bring in some optional scope skills to the system. We took an original round of requests to the scope committee. They had concerns about a couple of the items, so we've pared back a little bit. I think it allows a little more differentiation between what qualifies for a nurse CCT level and what can comfortably go with an expanded scope paramedic with some additional training and additional resources. So we are going to meet with the Scope of Practice Committee in early February and hope to have some more information then at that point, what that program may potentially look like and if we'll be able to move forward with that. So more to come on that. AMR is continuing to work towards an agreement for subcontracted CCT services with another provider. They're working through agreement language, things like insurance requirements and all of that. So we'll have another update on that as we get closer as well. Another big project that we're working on is First Watch. There are several components to that. For those who may not be familiar, it's a data aggregation system. So it'll take CAD data, PCR data, whatever elements we want to flow into that system, aggregate the information together and allow us to pull some meaningful data out and produce things like our response time compliance reports, our new clinical scorecard compliance reports, that sort of thing. So we've prioritized those two components of the system, or working towards those, and then we'll add in some of the other additional components as we get the high priority items finalized. So. And then the last item that I wanted to cover is nurse navigation. So I think everybody's familiar. There are the 4 working groups. They are all holding their 3rd individual meetings this week. 2 have already taken place for the call flow process. So we're getting close, I think, to finalizing the call flow process document that will be available to the dispatchers as a resource for how everything should work within the system. We also held the clinical determinant meeting already. During that meeting, we looked at data related to the determinant codes, their number that there were for each determinant code, and then the eventual disposition for those determinant codes. So Dr. Burley worked with the group to kind of whittle down the list of items to a manageable, reasonable clinically amount that will be the starting point for nurse navigation for calls to be referred to the nurses. What it looks like is that it will capture about 9% of the overall call volume for AMR. It was roughly 8,000 calls over the 2-year look-back period that we examined. So that's kind of in the range of where we were hoping to be. It's, I think, clinically conservative and safe for the patients, but still allows us to capture a significant number of calls to really feel an impact from the addition of the system. So we will continue to work on that, and that will be a large portion of the QI processes that we'll be implementing as well. Still meeting later this week are the community resource group. They are looking at things like clinics, doctors' offices, that sort of thing that are available in the community to put together essentially a telephone guide for the nurses to be able to refer patients to in the community. And then also the community education group, which will be putting together community-facing documents and public education for the system. So those meetings will take place tomorrow. In the meantime, EMS agency staff is also evaluating the need for any additional policies or changes to policies that will come about as a component of the nurse navigation program. So we'll be bringing those forward as we work on and develop those. And then earlier this week at the dedicated fire dispatch and fire ops meeting, we raised the conversation about fire agency response to calls that have been referred to nurse navigation, whether or not they will be terminating their response to those calls, and then whether or not they would like to respond to calls that when inevitably a call gets referred back to the 911 system from the nurse navigator, whether the fire department would like to respond to those. So I think those are 2 of the big outstanding questions and items that we'll need to do some work with the fire agencies to develop a plan for that. So those are the updates that I have at this point. I'm happy to answer any questions if there are any.
Deborah, I have a few on the nurse navigation. First, what is the go live or implementation target that you guys are looking at?
So the director, I forget her exact title, from AMR, who leads these projects, anticipates that we could potentially be ready as early as the beginning of March. I think we need more time than that to have the conversations with the fire agencies and to make sure the internal policies are in place. So the goal is still the first half of the year, but I don't anticipate March. I think it was second that she said being the go live date.
And then onto that, what is the marketing or outreach to the public with regards to this program? So there's some known expectation of someone when they call 911 that they may be transferred. What does that look like?
Yeah, so agencies, and so there are a few different counties in the state that have implemented that, as well as other states around the country. And there have been some different approaches taken to that. So some put out information in advance to kind of, brief people, educate people. Some people, some places have put it out right at the time of go live so that people aren't calling in early expecting that information. And others have put it out actually after it's launched so that I guess there's more of a little kind of soft roll in, kind of phase in of the program. So I think one of the conversations that will take place tomorrow at that particular working group is what the philosophy should be locally, and that'll come with input from all of the members of the working group. So the hospitals, any fire agencies that are participating, and I think, health department, PIO, that sort of thing, will have some good input on that. So it's a discussion that still needs to be had.
Will this be driven by the county or AMR or kind of a combination of?
A combination, yeah, yep. So I would envision that depending on what the timeline ends up looking like, that we will have some information on our webpage about the information. I would imagine AMR would post some on their website about the program, and then we'll have resources such as flyers, FAQs, that sort of thing that will be available. We could potentially hand out at public events or meetings or that sort of thing. So,
sorry, if I may, one of the big concerns that the ALS fire departments have is BLS ambulances within the system. Can you speak to that as to where we're at with the BLS ambulances, and are we strictly still dealing with those on transfer of care rather than 911, and what does that kind of look like?
sure, absolutely. So AMR has already brought some BLS ambulances into the overall system. Those are functioning within the interfacility transport side of things. So as of now, the plan, and I don't anticipate this changing anytime in the next 6 months, but the plan is to allow those ambulances to function on the IFT side of things for at least a 6-month period. Look at the data relevant to that as far as usage, UHUs, if there are opportunities for them to respond to other calls. The good news is we will have had First Watch in place for some time, so it will be easier to pull some of the disposition information for some of the lower acuity calls that maybe BLS might be able to handle, see what happened with those. We'll be able to look at that data. We'll be able to bring that data to the stakeholders. The fire agencies obviously will be a big part of that because they will be one of the ones who are most impacted by that addition if it does take place. Have those conversations and then make a determination as to whether it makes sense to expand them into the 911 realm of things. But we want to get at least 6 months worth of data under the new system, take a look at it at that point and have those conversations. So we're, at least 6 months out, probably a little longer from starting those conversations, if indeed that seems to make sense. So we're a ways away.
Okay. And then the last piece with the same line of the BLS ambulances with regards to special events, is there any change in that philosophy of a special event requiring an ALS ambulance, not a BLS ambulance?
I mean, there hasn't been. If it feels like something that would be useful, I think it's something that we can take a look at, obviously, depending on the event, the needs of the event, sort of past call history at the events and whether there have been need for ALS type services, all of the things that we look at that go into a medical plan type document. And then there's also the consideration of if they have to call somebody into transport, there would be the interactions with the ALS responders.
Yeah, that's a piece that we're concerned about is if we do have BLS ambulances on a special event and becomes an ALS call, what does that interaction look like? And do we have policies in place that allows a ALS first responder to hand off to a BLS transport if it doesn't meet the criteria for an ALS transport. We don't have that language in policy yet to allow us to do that.
Right, yeah, we have some language in policy that addresses, say, an AMR paramedic who's working with an AMR EMT and wants to, have the EMT attend on the call, that sort of thing, but we don't have the language that you're talking about. So I think that would need to be a part of that larger discussion, 6 months or so from now to.
Okay, just want to put that on the radar, so.
Yeah, absolutely.
Thank you.
All right, thank you very much. Moving to item F, EMCC member requirements. Steve?
Good morning. Happy New Year. And that's to provide the context for the membership requirements. So now that it's a new year, Form 700 is due again. So if you haven't received notice from the clerk, please let me know so we can make sure you can complete Form 700, Statement of Economic Interest. We get to do it as EMS agency staff. So yeah, we feel your pain. As far as other requirements for membership, only found one person who I couldn't find the oath of office for on our membership. So I'll reach out to you individually, see if you've got it. We just didn't get a copy, or if we need to have you get down to the clerk. Other than that, membership's looking pretty good. We've got a line on additional citizen rep members, and we're going to continue to reach out to the AMR folks related to the paramedic representative. And again, we'll reach out to Parks because John Anthony, at least last I spoke with him, he was very sure he was retiring at the end of 2025. So we'll need some new representatives. Other than that, that's where we're pretty much at with membership. Any questions? Thank you.
Okay, thank you, Steve. So no new business, and moving on to announcements for the good of the order. Any member of the committee may make an announcement or comments. The EMCC may not discuss or take action on any item raised during the announcements, except to decide whether or not to place the item on a subsequent agenda. Are there any items for the good of the order? All right.
If I could, there's a couple things coming up, just so you guys will be aware. Again, Happy New Year. It's 2026, which means it's time for this body to be looking at the annual report to the Board of Supervisors. So the EMS agency staff will probably do what we've done in the past couple of years and bring a draft for you to look at the March EMCC meeting. And then we can, adjust anything you'd like, have it ready for May. So we take it to the Board of Supervisors in July, as we've been doing. Also, we'll be looking very soon. And so just anybody interested, well, you can continue, but at the end of the rollover year, which is July 1 for the new EMCC appointments, we'll be reaching out to you for continued appointment, as well as we'll be looking for someone to fill the chair. We'll continue if you'd like. So those are some things that are coming up related to this body we should share with you.
All right, thank you, Steve. All right, so the next meeting scheduled for Wednesday, March 11th at 10:30, and we'll adjourn. Thank you very much.
Thank you all for your participation.